Which of the following is a clinical sign of a large ASD with a significant left-to-right shunt? A. Precordial heave at the left lower sternal border. B. Weak and thready peripheral pulses. C. Narrow pulse pressure. D. Diastolic murmur at the apex. Answer: A. Precordial heave at the left lower sternal border, due to right ventricular hypertrophy/volume overload. In the context of a secundum ASD, the aortic rim is the tissue located between the defect and which structure? A. The superior vena cava. B. The aorta. C. The mitral valve. D. The inferior vena cava. Answer: B. The aorta. Note, this is the rim most commonly deficient in secundum defects, but closure is still often possible. Why does a patient with an ASD often have a normal ECG in early childhood? A. The shunt does not begin until puberty. B. The right ventricle is naturally thick at birth, and the added volume from the ASD takes years to cause detectable remodeling. C. The ECG only detects pressure, not volume. D. Pediatric ECGs are not sensitive enough to detect axis deviations. Answer: B. The right ventricle is naturally thick at birth, and the added volume takes years to cause detectable remodeling. An adult patient with an unrepaired ASD presents with dyspnea. Testing reveals a pulmonary artery systolic pressure of 60 mm of mercury. This indicates: A. Normal aging. B. Pulmonary arterial hypertension, group 1 PAH. C. Essential hypertension. D. Left heart failure. Answer: B. Pulmonary arterial hypertension. Which type of ASD is technically not a defect in the atrial septum itself, but rather a communication due to the absence of a common wall? A. Ostium primum. B. Ostium secundum. C. Sinus venosus. D. PFO. Answer: C. Sinus venosus. When using the M mode on an echocardiogram for a patient with ASD, which finding is characteristic of right ventricular volume overload? A. Paradoxical septal motion. B. Increased left ventricular end diastolic diameter. C. Systolic anterior motion of the mitral valve, SAM. D. B-notch on the mitral valve. Answer: A. Paradoxical septal motion. The interventricular septum moves toward the RV in systole instead of the LV. What is the most common reason for a residual shunt after a percutaneous ASD closure? A. The device was too small for the defect. B. The device was too large. C. The patient developed a new hole. D. The device dissolved. Answer: A. The device was too small for the defect. In a patient with a primum ASD, the associated cleft mitral valve usually causes which hemodynamic issue? A. Mitral stenosis. B. Mitral regurgitation. C. Aortic stenosis. D. Pulmonary regurgitation. Answer: B. Mitral regurgitation. Which of the following describes the eustachian valve in the context of ASD/PFO diagnosis? A. A valve located in the pulmonary artery. B. A flap-like valve at the junction of the IVC and right atrium that can direct blood toward the septum. C. A pathological growth on the mitral valve. D. A vestigial structure in the left atrium. Answer: B. A flap-like valve at the junction of the IVC and right atrium. A patient with a small ASD who wishes to become a professional scuba diver is at risk for which specific complication? A. Hypertension. B. Decompression sickness, BENS, due to paradoxical gas emboli. C. Nitrogen narcosis occurring at shallower depths. D. Pulmonary edema. Answer: B. Decompression sickness, BENS, due to paradoxical gas emboli. In embryology, which structure eventually forms the floor of the fossa ovalis? A. Septum primum. B. Septum secundum. C. Endocardial cushions. D. Sinus venosus. Answer: A. Septum primum. What is the Amplotzer septal occluder primarily made of? A. Stainless steel. B. Nitinol, nickel titanium alloy, and Dacron fabric. C. Biological porcine tissue. D. Solid plastic. Answer: B. Nitinol, nickel titanium alloy, and Dacron fabric. Which of the following leads to cyanosis in a patient who previously had a simple ASD? A. Increased left-to-right shunting. B. Development of Eisenmenger syndrome, right-to-left shunting. C. Spontaneous closure of the defect. D. Successful surgical repair. Answer: B. Development of Eisenmenger syndrome. If a patient with an ASD develops right heart failure, which physical exam finding would likely be present? A. Splinter hemorrhages. B. Jugular venous distension, JVD, with a prominent V wave. C. Decreased breath sounds at the bases. D. Brachial femoral delay. Answer: B. Jugular venous distension, JVD, with a prominent V wave. Closure of an ASD in patients over age 40 has been shown to A. Be completely ineffective. B. Reduce the risk of future heart failure and improve exercise capacity. C. Only be necessary if the patient has a stroke. D. Increase the risk of lung cancer. Answer: B. Reduce the risk of future heart failure and improve exercise capacity.